Hello, it's Dr. Daniel Cameron. I'm discussing a common sense Lyme disease case discussion today. Can you imagine being 23, having delivered a baby, had a swollen knee, got diagnosed with Lyme disease, and you're thinking, I didn't see a tick, I didn't see a rash, but I did have a swollen knee at 6 months that was similar to after you delivered. So I'd like to discuss the concept of been pregnant and what it all means. So let's take a look at this particular case. Now, this is a case by Pavia. It's a woman who developed Lyme disease symptoms after giving birth. Now, I'm a doctor, also a epidemiologist and an author, but this is not intended to replace your doctor who is taking care of your Lyme disease or whatever illness that you might have, because that requires a unique clinical assessment. Now, this is a 23-year-old woman from Brooklyn who 3 days after delivery had a baby. She had bilateral knee swelling and pain, and similar knee pain at 6 months, which I had talked about earlier. There were several trips made to woodland areas in upstate New York, but she had no tick bite or rash to be sure when she might have been exposed. She might even have been exposed even before that 6 months into her pregnancy, because sometimes Lyme doesn't show up with any findings until you get a swollen knee. She had a positive Lyme test by IgG rather than IgM. IgG tends to be around longer before you get that. Also, 9 out of 10 bands is more than the 5 out of 10 bands that you need to meet the CDC criteria. So they confirmed Lyme, gave 3 weeks of doxycycline, and the mother was well, and the baby was well. But I wanted to discuss that in a little more detail. Also, I have a question and answer at the end. So the key discussion points is, why was the mother asymptomatic during the pregnancy? Oftentimes that is the hormones that's used to get through the pregnancy. And this baby presented, the mother presented without any other findings. There was no evidence of congenital Lyme disease, but of course that's difficult because babies can't report brain fog, can't report fatigue. They have also not really followed babies up that well over time, and we know that perhaps as many as 1 out of 3 people develop chronic issues after Lyme. Now, this was diagnosed based on clinical history, and the test confirmed it, but the doctors already ordered the test, means they were making some clinical judgment. Now, 3 weeks of doxycycline work, but there are plenty of patients where that doesn't work or they have recurrent issues. Maybe they'll have a co-infection. So the article was summarized saying that there was suspicion of Lyme in postpartum, but it raised up that question of what about the baby and what about the mother, and was the immune system suppressing the expression of the disease? So I wanted to tell you this paper by Pavia raises some interesting questions. So I made a few up, which is, what were the primary symptoms reported by the patient postpartum? This was bilateral knee swelling and pain. Where did the patient like to get exposed? In this case, the wooded areas upstate New York, but of course there's plenty of places to get exposed, plus the pet exposure, camping, hiking. And did the patient recall a tick bite or a rash? No, but that's very common. Now, if they had seen a tick, had a rash, and she was about to get pregnant, I like to make sure I treat that woman before delivering. If the Lyme disease starts before they get pregnant, it often suppresses the symptoms, but the symptoms are still important to me. How was Lyme disease confirmed? In this case, it was a Western blot, IgG, rather than a clinical diagnosis. We have to use clinical diagnosis because the ELISA might be positive, the CDC 2-tier might be negative, plus you have to use clinical judgment. How was the patient treated for Lyme disease? In this case, it was 3 weeks of doxycycline, but I often find in practice that patients aren't well at 3 to 4 weeks. I usually start with 4 weeks and have them come back to reassess. One of the things I reassess for is Babesia, which is a parasite that doesn't work for Doesn't parasite that doxycycline doesn't work for. There's other drugs that are used for Lyme, like amoxicillin, ceftriaxone, and azithromycin. What was the outcome for the mother after treatment? I have to mention that she had her symptoms resolved. Now, with time, there are patients in my practice, there are patients in the literature where they do well, but then over time they do poorly. How did the Lyme disease affect the newborn? In this case, the baby was asymptomatic, but you have to realize that follow-up is important with any baby that might have been exposed to Lyme disease. And what does this case suggest about Lyme disease during pregnancy? Lyme disease can be asymptomatic according to the author and manifest postpartum. And Lyme disease is not always symptomatic during pregnancy. And how was congenital Lyme disease ruled out in this case? The author said that test was negative, but you have to realize that the blood test is not as reliable as we would like. Newborns may not even make a positive antibody response. There's always a question of what is gestational Lyme disease, and does it occur, and how often does it occur? So thank you for joining me for this common sense Lyme disease case discussion. I'll be doing more of these in depth over time, so please leave any questions or comments in the comments section below. Thank you for joining me. Appreciate you being part of this process.